Hi, it's Patricia Coughlin. First of all, I just want to wish everybody in North America happy Thanksgiving. This has been a very trying time, and yet if we focus on it, we'll see that we have an awful lot to be grateful for. And I'm grateful for this community and this opportunity to share my ideas and knowledge and skill with all of you. So, what I wanted to talk to you about today is the importance of identifying, recognizing, and facilitating unconscious as well as conscious communication with your patients. I think many therapists, and not just CBT therapists, certainly but many, really confine their listening and speaking to the conscious rational mind of the patient. And doing so limits you tremendously. The conscious mind is, the surface layer and is rarely the driver when we're talking about behavior. In fact, without access to emotion, we can't decide what to wear or what to have for breakfast. Okay, never mind who we're going to choose to marry or where we're going to live, right? This is all heavily influenced by unconscious emotional needs and desires. The fact that this is even a question in our field, I find alarming. Certainly, advertisers know this, marketers know this, politicians know this, right? That we choose who to vote for in a nanosecond, right? And then we layer rationales on top. So if you want to be effective, right, you need to recognize, listen for, and speak to both the conscious and unconscious level of communication that's happening between you and your patient. So let me give you a recent example. I was seeing a patient by Zoom during the pandemic time, and he revealed that he had been hooking up sexually with strangers that he met on the internet. Now, it seemed quite clear to me this was a very risky kind of behavior to be engaging in during the time of the pandemic. And so I started to question him about it and to really challenge all of his minimizing and rationalizing about how you have to trust people, even though these were utter strangers, and the idea that he was somehow going to be the only person that they were engaging with in this way seemed highly unlikely. So, on a conscious level, he was getting angry with me. And if you also think about the alliance, right, which we talk so much about in psychotherapy research and practice, almost everyone is talking about the conscious therapeutic alliance. And that is important, right? It's the agreement about why you're there and what you're going to do. And yet there's also an unconscious component to the alliance. So on a conscious level, not only is he getting angry with me for challenging him, he starts pulling away, creating distance, and it would look like, the conscious therapeutic alliance is in trouble. However, recognizing the unconscious communication let me know that the unconscious alliance, which is the healing force in the patient that will cooperate with you in getting to the source of the problem, will come into operation. So while consciously he's angry and he's resisting me and rationalizing and justifying, at the same time, he reveals a dream he had about being in cahoots with some psychopaths and doing things that were clearly dangerous and unethical and so on. And so I asked him, well, what do you make of the dream? And he said, well, clearly on some level, I'm really alarmed, right, by what I'm doing. So consciously, he was angry. Consciously, he was resisting. And yet he started to produce unconscious material letting me know that we were on the right track. So I invited his feelings of anger toward me. And again, while there was the conscious component, the unconscious rage that is underneath the conscious anger started to get mobilized and was clear in his nonverbal body signals. So as we went to the experience of the anger and the aggressive impulses that mobilized, right, he had an urge to strike out, to assault me, and then he started to have sexual feelings and images of using his penis as a weapon to assault me, shoving his penis down my throat and so on. And he was horrified and overcome with guilt about having this kind of fusion of sexual and aggressive impulses toward me. It then was spontaneously linked to this mix of feeling toward his mother and also toward a previous girlfriend. And so we were now able to discover the source of his guilt that was driving not only his need to punish himself with constant self-criticism and so on, but why he would engage women to use and abuse him and basically punish him. So I hope that this illustrates not only the difference between, but sometimes the relationship between conscious anger. In this case, if I had just stayed with conscious anger, we would never have gotten right to this depth and to the source of his suffering. But going with that conscious anger, allowing it to get mobilized in the body, and then watching for the unconscious signals and communications about the aggressive impulses coming up, opened up the unconscious. We got to that unconscious deep level of sadistic rage toward women and guilt about that rage, which had been driving his need to punish himself and to have women punish him, right? Doing this also really fortified the unconscious therapeutic alliance, which again is the healing force. So I hope this is clear to you. If not, certainly let me know. And I hope you get more and more curious and more attuned to the unconscious levels at which our patients are communicating with us, so we can get to this deep level where the source and the origin of the patient's problems reside, and also where that unconscious healing force exists and can be fortified. Okay, so happy Thanksgiving, and I'll talk to you soon.